Hi everyone, this is Dr. Beth Kitchen. I'm the patient educator in the UAB Osteoporosis Prevention and Treatment Clinic. And in this video, we're going to take a look at your risk for osteoporosis. And what we're going to focus on are the risk factors that you really don't have a whole lot of control over. This is the risk factor checklist that I use in our clinic with our patients to kind of help them to see why they might be at risk for osteoporosis. So let's take a look at the first half of this. Again, the ones that you don't have as much control over. Look at the first risk factor there. Simply being a woman puts you at greater risk for osteoporosis. Now, this does not mean that men don't get osteoporosis. They do, and they probably get it a little bit more frequently than what you'd expect. It's just more common in women, and in particular, postmenopausal women. Why is that? Well, when we start menopause, we lose estrogen. That's kind of what defines what menopause is. And it turns out that that estrogen is really good for keeping our bones strong. So when estrogen drops, bone density drops. Now, if you took estrogen replacement therapy at the time of menopause, then you might have kept that bone loss from happening. But once you go off the estrogen, whenever that is, you start to lose bone density again. Now, all the rest of the risk factors are for both men and women. Age is a big risk factor for osteoporosis. This is a graph that shows you bone density over the lifespan. And what you can see here is as we age, when we're younger, the bone density actually increases. So here we are, we're little kids, teenagers, young adults, and we're in a very active phase of bone building when we are younger. So it's pretty easy to build up the bones. If we get some calcium from our foods, we get some sunlight to make vitamin D to help us absorb that calcium, we get some exercise, and you can see this pretty good increase in bone density, all up until about the age of late 20s, early 30s. The bone density kind of stays there for a while. Then as we get into our late 40s, 50s, 60s, and beyond, you start to see the bone density going down. We can't maintain that high bone density. Now, calcium, vitamin D, and exercise, yeah, they'll help to slow down this bone loss. They're still important, but they're not enough to keep us from losing bone. They're not enough to prevent osteoporosis by themselves. Women, notice this little dip right here that we have that the men don't have. This is menopause. The average age of menopause is about 51. But wherever you started menopause, those first 5 years after that is where you have a pretty rapid bone loss. The bone loss slows down after that, but you can see it keeps going down. Now this looks pretty depressing. It looks like once you start losing bone density, that's it. You just keep losing bone density. And the good news is that this is what happens if we do nothing to stop the bone loss. We're going to talk in later videos about all the things we can do to slow down this bone loss, stop the bone loss for many people, and also for many people actually increase the bone density. And that's the good news. This doesn't have to happen. The other thing this kind of makes it look like is like everybody gets osteoporosis. Well, everybody loses bone density as they get older, but some people lose it so slowly that they never get into any trouble with that. So that's the difference there. Now, what are some other uncontrollable risk factors? Well, a family history. If your parents or grandparents or a sibling has or had osteoporosis, you might be at risk as well. Now, some people know if they have a parent or other family member who has or had osteoporosis. Other people tell me, how do I know that? They didn't get checked. I really wasn't aware of whether or not they had it. Well, there might be some clues in your memory. I always tell people, if you think back and you remember a parent or a grandparent shrinking, losing a lot of height, having that dowager's hump, that's a sign of broken bones in the spine caused by osteoporosis quite frequently. If you remember a parent or a grandparent breaking a lot of bones, walking with a walker, that might be a sign that you have a family history. And this is a pretty strong risk factor. Genetics play a pretty strong role in how strong your bones get and how rapidly you lose that bone density. The next risk factor is being thin. This is one of the few diseases where being thin actually puts you at greater risk. Now, that doesn't mean I tell my patients to gain a bunch of weight, because that would put them at risk for diabetes, heart disease, high blood pressure, some cancers. So I don't want to do that, but it is a risk factor. Now, there are some patients that I do work with on weight gain. If they are really below a healthy body weight, if they're really suppressing their caloric intake, they're not eating enough, excessive dieting, maybe they've been losing weight too quickly, then I might work with them on weight gain. But for some people, they're thin, healthy, it's a risk factor, but not one we're necessarily going to change. Now, the last of the uncontrollable risk factors are the medicines that you might have to take for other diseases or conditions. Modern medicine's great. We have all these medicines to treat various diseases and disorders, but the problem is that medicines have possible side effects, and the possible side effects of a few medicines is low bone density that can lead to osteoporosis. One of the big ones that we see with our patients is prednisone and other corticosteroids. These are also called glucocorticoids. These are important medicines, and they help treat a variety of different conditions. So they can be really important for people to take. But if you've ever had to take these for 3 months or longer continuously, they might have lowered your bone density. Another common one is the anti-seizure medicine Dilantin. That can also cause low bone density. Some women have to take aromatase inhibitors. These are medicines that help prevent and lower the risk of breast cancer, help to treat breast cancer. And so these medicines, Arimidex, Aromasin, Femera, they can lower the bone density because they block estrogen. So that can be a problem. They're important to take for the prevention of breast cancer, but they can also lower the bone density. And then another one that you might see a lot of people taking are these medicines that we call PPIs, proton pump inhibitors. These are really important for people who have stomach acid problems, acid reflux. And these are really important for your quality of life. They can really help you to eat the foods that you like to eat, keep that stomach acid under control. But they can also be associated with lower bone density and an increased chance of breaking a bone. Now, with all of these medicines, they may be really important for you to take. So we're not saying stop taking these, but if you do have to take these, you may want to talk to your doctor and say, what are some things that I need to do to take care of my bones? And should we be keeping an eye on my bone density? So those are the risk factors that, again, you may not have a lot of control over. In the next segment, we'll talk about some risk factors that you can actually do something about.